Hello and welcome back to Module 2. Why has my dog got arthritis? What can I learn for the future? So sit back and relax, let's go. So in the first module, we covered what is arthritis and what is the fuss. And this one, we're going to cover what can I learn for the future and why has my dog got arthritis? So just to recap, arthritis. It can be divided into two simple categories: primary osteoarthritis and secondary osteoarthritis. Primary osteoarthritis is inevitable with aging. We all will succumb to some degree of arthritis through the wear and tear of life. Generally, this is presented with multiple joints in a more symmetrical fashion. What we see more commonly is secondary osteoarthritis. And this is seen in certain breeds due to abnormal joint formation, joints that have undergone surgery or trauma, joints that have undergone disease, or joints that have been used repeatedly inappropriately. So, talking about breeds that are predisposed, a very simplistic way to look at why has my dog got arthritis is the following. It can be due to a normal life, normal forces, but on abnormal joints. These are breeds that are prone to imperfect joint development, where they don't fit so snugly, they don't function so smoothly, and over time they start to wear out prematurely. Or it could be due to abnormal forces on normal joints, in breeds that are pushing their bodies to the extreme and regularly repeating the same exercise again and again and again. Or we can see an element of both. So to recap, there is primary osteoarthritis, which is the natural wear and tear, and we see it often in working breeds. In commonly affected joints, it's generalized and often symmetrical. But the more common form of osteoarthritis that we see as vets is secondary, and this is due to abnormal joint development, such as the dysplasias, osteochondrosis, luxating patellas, abnormal growth plate closures, or trauma. So to recap on breeds predisposed, we do know certain breeds are more likely to get joint problems. A recent survey showed that the Rottweiler was the one that actually suffered the most from arthritis, having high levels of elbow dysplasia and hip dysplasia within the breed. But other breeds also have a prevalence of these joint abnormalities. So with that in mind, how can we prevent arthritis? Well, the truth is, we can only but minimize, because there are so many things that influence the development of arthritis. But what we will do is look at the following categories: breeds, health assessment, nutrition, weight control, exercise, home life, attending to injuries early and monitoring them, and the activities we choose to do with our dogs. So breeds. As said, there are predisposed breeds, and Rottweiler features highly. Other breeds: Old English Sheepdog, Dog de Bordeaux, and the Labrador Retriever. How can we minimize the prevalence of arthritis developing in these breeds? Well, we can look at our breeding. It's very common now for breeding individuals to be scored, hip scored and elbow scored being the most common. By looking for progeny of dogs that have been screened and scored, we are likely to have better joint development and less likely arthritis. So what we would encourage you is, when looking at purchasing a puppy, look at the breed and look to see whether the parents have had health checks and scoring performed. I would like to take this opportunity to talk about Vet Compass. Not many know about this. This is the Veterinary Companion Animal Surveillance System. and it's an international initiative focused on improving companion animal health. It's a not-for-profit research project, a collaboration of the Royal Vet College and the University of Sydney. And their aim is to investigate the range and frequency of companion animal health problems. Through their work, accessing data in local veterinary practices, we can get more information about the common diseases that us vets are seeing. And I'd like to show that osteoarthritis features heavily up there, with per 1,000 animals, 37.6 are related to osteoarthritis. This is only exceeded by skin problems, and ear disease again features highly at 102. This just demonstrates that osteoarthritis is a common disease that we see as vets on a daily basis. So hopefully we can promote its prevalence into having better structure and protocols for your owners to follow. Next influencer on the development of arthritis is nutrition and weight control. So this is a disease that isn't due to dietary deficiencies. What evidence we do have suggests that it's actually related to excesses. And there is evidence to suggest that high levels of calcium and vitamin D in the diet can influence the disease progression. High levels of calcium causing hypercalcemia in the blood can affect the endochondral ossification and delayed bone remodeling. What does this mean? It means to us that when we are looking at our dog's diets, supplementing and trying to get them as big as possible, as quickly as possible, using nutrition to do so, is not a great idea. Let them grow at their own rate. Encouraging rapid growth by adding to their diets does lead to a higher incidence of growth deformities. With regards to weight, Vet Compass, having just told you about that initiative, they have found that dogs that are greater than their average weight for their breed are 2.3 times more likely to be diagnosed with arthritis. Again, excess nutrition plays a huge role in the development and the pain of arthritis. Following on from nutrition, what we need to make clear is being overweight doesn't actually cause arthritis. It creates a clinical consequence. Thank you, Dr. David Dicus. What does this mean? It means that having an overweight dog doesn't actually cause the disease. It affects the disease that was already there. So a dog that might be prone to arthritis, such as a Rottweiler or a Labrador, is more likely to succumb to earlier onset and severe signs by carrying excess weight. If the breed is susceptible, then allowing them to be overweight will cause arthritis to set in sooner, and they will require medication for pain relief earlier. Maintaining a lean body weight throughout life is proven to slow the onset, progression, and the pain of arthritis. And guess what, guys? It's free of charge. So to recap, nutrition does influence arthritis, but it's an excess of nutrition, not a deficiency. A take-home fact for you. A lifetime study was performed on a group of Labradors. They were divided into two cohorts. One was allowed ad lib feeding, and the other group was fed 25 to 35% less. The ad lib group developed radiographic signs of arthritis 6 years earlier, and they started medication 3 years earlier. This is 100% proof that having excess weight on your dog is really going to influence the development and progression of this disease. Controlling your dog's weight is imperative. I'd like to show you one of our CAM followers. We're very grateful for this photo. This lovely guy, on reading our posts, put his dog onto a very strict weight loss plan. And this is the amount of weight that this dog lost. 8 bags of sugar. The dog went from having quite a sedentary, slow pace of life and being reliant on anti-inflammatories to now having a life of a younger dog and apparently pain-free. Appropriate exercise. Now this is more logic. There is not a huge number of papers to refer to. But joint development is influenced by nature and nurture, i.e. use. Cartilage development is influenced by weight bearing. Ligament development is influenced by use. Muscle development is influenced by exercise. And coordination and proprioception, i.e. knowing where that limb is in space and time, is influenced by activity. All of these are needed for good joint function. So if we are performing inappropriate exercise in young growing dogs, we are surely leading ourselves to a fall. Could we do more by ensuring that as our dogs are growing and they're in their vulnerable stage of joint and bone development, ensuring that they're doing exercise that is appropriate for them? I would like to demonstrate this point with this short video clip. So this video clip shows a young puppy on a laminate flooring, struggling to get any traction whatsoever. The legs are splaying and going directions they shouldn't go. Is this going to influence this dog later in life? Logic says yes. Next category, monitoring old injuries. Many people on having a lameness resolve feel that the job is done. There is no longer a problem. When in fact, actually, there certainly could be a smouldering problem waiting for a few years before it shows itself. I would like to illustrate that point with a picture from my own dog. A number of years back, we were concerned that she had neck pain. We did the appropriate interventions. She had imaging, a CT scan and an MRI, and no problems were found. So I put it to bed. A number of years later, we were taking x-rays of her shoulder because there was discomfort there. And we found that that previous suspicious injury had actually developed into intervertebral disc disease, which you can see here. I learned firsthand that monitoring old suspicions and old injuries is important because they do often come back to reveal themselves later. So if your dog has had a bout of lameness, recurrent lameness, keep an eye on it, monitor it, and check that it isn't progressing. Activities. The activities that we choose to do with our dogs can certainly influence their musculoskeletal health. I'd like to just demonstrate that with this video here. This video clip shows dogs having great fun. Agility, flyball, etc. These are high strenuous activities, often repetitive in nature. These games are done again and again and again. We certainly don't suggest that you shouldn't be doing these, but we do suggest that you should be checking that your dog is capable and not suffering after effects. These are very strenuous exercises that put a lot of strain on the dog's body. Making sure that your dog is physically fit to do so is important. So regular health assessments are ideal. So, we're at the end of Module 2, and in summary, arthritis is often secondary osteoarthritis due to inappropriate joint structure, also known as incongruency. Certain breeds are more predisposed. Health assessments before breeding should minimise the prevalence, as we know that there is a genetic component. Overnutrition plays a role. Weight control is imperative, and it can affect the age of onset, the progression, and the level of the pain that dog is experiencing. Inappropriate exercise likely plays a role in the development and the progression. Home life can certainly play a role in development and progression. Attending to injuries early and then monitoring them should enable you to identify cases of arthritis early, to which we know the best management plans can be achieved. Consider the activities you ask your dog to do and look at their physical capabilities and what they are showing you after. If you are an amateur agility dog owner and your dog is lame, slow, stiff, 1 to 3 days post-exercise, then question whether you're allowing them to do too much. It's too strenuous, and whether a health check would be appropriate.